Have you ever wondered, how do our medical teams know how to treat somebody who's had a cardiac arrest? Or maybe you're the healthcare worker and you're like, I don't know what I'm looking for. Well, in this video, I want to share with you the H's and the T's. It's a mnemonic that we use in advanced cardiac life support to help us identify the cause and treatment for our patients so that we can reverse the situation. Now, this is important for healthcare providers at any stage of their career to know. If you are working in emergency, ICU, or in a step-down unit where you know your patients are at risk of having a cardiac event, knowing this information may be the thing that helps prevent a cardiac event as you start to assess your patient with these in the back of your mind. So you have a patient that's crashing, doesn't look so good, or maybe has already crashed and they're in cardiac arrest. You need to know the H's and the T's in order to help troubleshoot any potential reversible causes so that you can anticipate your nursing interventions, tests that are going to be ordered, and be a part of the solution when people are asking, when the doctor says, all right, guys, what do you think's going on? You can pull information from your H's and T's. It's a handy mnemonic to help you identify the most potential causes of your patient's current condition. Let's quickly run down the H's and then we'll talk about them here briefly. So when we think of the H's, think of everything to do with the blood. We have volume, we have sugars, we have temperature, we have oxygen, we have electrolytes. And so we have hypovolemia, low in volume, hypoxia, low in oxygen, hyperkalemia, high in potassium, or hypokalemia, low in potassium. We can also have hypoglycemia, low in sugar, hypothermia, very cold temperature. And then the acid-base balance is represented by hydrogen ions. So let's take a look at these individually. All right, so now that we know what the H's are, we need to understand how do we evaluate for them. So if we have an assessment, we can evaluate to rule in or rule out if this is the cause, and then that information will help us determine the interventions that this patient needs.
In the case of hypovolemia, you're going to be looking for obvious signs of blood loss. You may need an ultrasound to check for internal bleeding, but the treatment is going to be to start an IV and replace those fluids. When it comes to hypoxia, you can put on your O2 sat probe right at the bedside, and of course a blood draw will be done as well. Your treatment will be to administer oxygen and put in an advanced airway. Hyperkalemia, high potassium, we're going to need a blood draw and check the history for things like renal failure and diabetes. If it is, we're going to treat with calcium chloride, sodium bicarb, glucose plus insulin. Hypokalemia, again, another blood draw, checking for the history of use of diuretics or loss of fluids from vomiting, and the treatment will be magnesium and potassium infusion. Hypoglycemia can be tested right at the bedside with a bedside glucometer testing, and if they are low, we're going to treat that with IV dextrose. When it comes to hypothermia, we want a core body temperature, and we're going to treat this with gradual warming such as fluids, a blanket, or even a warmer. Hydrogen ions, so acidotic patients, another lab draw will be done. It's an arterial blood gas. You may notice a fruity odor on the breath, and we will treat that with sodium bicarb and ventilation.
Okay, so let's look at our T's. Now, when you're thinking about T's, I want you to think about a gun, lead bullet being shot through your chest on the side in which your heart is. Okay, because this is going to be critical to understanding some of the elements. So think about this. This is traumatic, isn't it, right? So trauma is one of the first T's to think about. I'm shooting a lead bullet. A lead is a toxin. So toxin is our second T. Tablets and toxins. This is piercing into the chest cavity where I have my lungs and my heart. So it can create a tamponade, a cardiac tamponade, in which there's blood that surrounds the outer membrane of the heart and squeezes it. It can also cause a tension pneumo, where air is escaping from the lungs, but it's staying within the pleural membrane and putting pressure on the lung, collapsing it towards the other side. And then the last thing you can do is, because it's just pierced the vascular system, is it may release a clot. So it can cause a thrombosis, which is a clot either that goes into the lung, a pulmonary embolus, or one that goes into the heart, which is going to cause myocardial infarction. So as a quick rundown again of the T's, we have the gun shooting a lead bullet into our chest, trauma, toxins, cardiac tamponade, pneumothorax, and then we have thrombosis of the lung or the heart. Those are your T's. So let's go back to these now. So trauma.
If we're looking at trauma, we need to have a history of presenting illness. We may see ECG changes of various presentations, and our treatment will depend on the information received. If we're looking at tablets and toxins, we need to do a lab draw, urine samples, medical history to find out what may be the cause of this, and we'll be looking for any antidotes and reversals that we can use or symptomatic treatment. Cardiac tamponade, we're going to find no pulse with CPR, vein distension, and our treatment is going to be a pericardiocentesis. We need to get that blood out of there. Thrombosis of the lung, again, we need a blood draw and history. The treatment is going to be surgical embolectomy. We need to remove that clot, and maybe fibrinolytics. And if it's a thrombosis of the heart, cardiac, we're going to do a 12-lead ECG, blood draw, and the treatment is likely going to be CPR, and it depends on how the patient responds.
It's extremely beneficial for you to know the H's and the T's, both in working with your patient's pre-cardiac arrest and post-cardiac arrest. You may be able to head off a cardiac event by being aware of these situations and the assessments that go with it. And post-cardiac arrest, you may be able to reverse the patient's condition. This is Tammy from NurseMinder. Go out there and make it a great day.